Welcome back. Thank you for joining us again on We for Nursing TV. And as we promised to always provide you with a good information regarding nursing care, today we have an interesting topic, which is nursing care plan. And to start with the definition, nursing care plan, it's a very common document that is well known in nursing care, and it's a structured clinical and legal document developed by the nurses that shows the assessment findings and identify actual or potential problem. You just show the nursing diagnosis after showing or listing these assessment findings, and then set a measurable and patient-centered goals. And after setting these goals, you show a detailed evidence-based nursing intervention, provide the scientific rationale for this action, and then later you show an evaluation of your set objectives. So this nursing care plan is very important as to promote, it maintain and restore the health of our patients. So nursing care plan, it includes 5 main steps, which is assessment, the first one. This is a first column that we normally use in nursing care plan, and this assessment, it includes 2 main parts. There is subjective data and there is objective data. From the subjective data, there are base information you corrected during history taking, and then from the objective data, there are this information you've got from the physical examination you have been doing, the investigation you've took, the imaging studies found. They are found in objective data. So the assessment part will list the subjective information, will list the objective information, and will be done with the assessment. Then you will show also this second column, which have the nursing diagnosis. Of course, it will include the actual problem the patient is having, or the potential one the patient is about to face according to the assessment you've done, and then you will intervene according to this nursing diagnosis. And then you will show this planning phase, and here in planning phase, like, you will be having a SMART goal. SMART goal means specific, measurable, achievable, realistic, and time bound. Of course, a good objective should have 5 main tips for a good objective, which is specific, to be specific, measurable, achievable, realistic, and time bound. We are going to see an example below that shows a planning part where we will include that one. There is also an implementation. Here on the implementation part, you will be showing a different nursing intervention with the rationale of how to address the identified problem or no nursing diagnosis. The last column will be an evaluation, where you will be evaluating after the set period of time in planning, and then you see if your objective has been totally achieved, partially achieved, or not achieved. So these are the main steps of nursing care plan. So nursing care plan, how should it look like? What is the format of it? And here the format may vary according to the institutions, but however much the institution may adopt their own way of doing it, they have here they are very good and main columns that should not miss while we are preparing a nursing care plan. The first one, it is assessment column, where we have said that there is subjective and objective data. There is nursing diagnosis column, where we show the problem, which should be actual problem or potential problem, where here the next column will be planning, where we'll be showing the planning phase, and the goal will be listing there. It should be in a smart way, and then you will have an intervention on this nursing diagnosis and planning you've done. Then this intervention should have a rationale, like there's the scientific reason of why are you intervening in that way. Are they evidences, like scientific ones, that can justify your intervention? Then later you show an evaluation column, where you will evaluate the set objective. So from another list, like in surgical ward, they are frequently nursing diagnosis found there. They are not limited to these ones, but most of the time we found these ones here. There is surgical site infection, like there is a wound, someone is dressing, and there is ongoing pulses coming from there, and it needs squeezing, like you can take out these dead tissues. So this surgical site infection should be a good nursing diagnosis to use. Risk for surgical site infection, like there is an open wound, there is at risk of entering an infection there, so you want to dress it, so you can use this risk for surgical site infection. There is impaired skin integrity, and you are going to dress it, you are going to provide an education so that this skin integrity will be restored. So this one can also be used. There is risk for infection, there is risk for pressure ulcers, like these ones who are bedridden for a long period of time, and you will intervene accordingly. Then there is acute pain. When the pain has not lasted 3 months to 6 months, it will be called an acute pain, and you will address it according to the pain score you've done. And according to the pain score, there are these ones that can be addressed using pharmacological interventions. There are the other ones you can address without using pharmacological intervention. So it will be depending on the level of the pain, so that we can intervene accordingly. There is a chronic pain. When it has listed more than 3 months to 6, it's now no longer an acute pain, it's now chronic. So there are other nursing diagnoses, like in internal medicine patients, like ineffective breathing pattern. When there is difficulty in breathing, when the patient is struggling to breathe, you can use this one. There is impaired gaseous exchange, like you measure the oxygen saturation, and you found that the patient is having low oxygen. It shows that that patient is retaining the carbon dioxide. Or you do an arterial blood gas, and you find that the patient is having retaining of carbon dioxide. When the carbon dioxide level is that much high, we normally know that the normal ranges of carbon dioxide should be in 35 to 45 when you are doing arterial blood gases. And when you find that it is above 45, it's now becoming something of acidosis, respiratory acidosis, and you will intervene accordingly. So this impaired gaseous exchange can be used. There is also impaired spontaneous ventilation. Taking a scenario like someone has arrested and you have done a cardiopulmonary resuscitation, the patient came back to life, but his or her respiration is not much promising, and you decide to do an intubation and you put on a ventilator machine. So this impaired spontaneous ventilation, like this intervention you have been doing of cardiopulmonary resuscitation or putting on ventilator machine, this impaired the spontaneous ventilation can be a good nursing diagnosis to use. Excess fluid volume, like when someone is having an edema and you want to administer diuretics, or you want to administer drugs that can increase the oncotic pressure, like human albumin, this excess fluid volume can be much better used. Deficient fluid volume, like when someone is dehydrated and you want to administer IV fluids, this can also be much better. Urinary tension, like you've done assessment, physical examination, and you find that the bladder is distended, and you decide to insert the Foley catheter. This one can be a good nursing diagnosis. There is a risk for venous thrombosis. When someone is bedridden for a long period of time, he or she is at risk of this venous thrombosis. When you administer thrombolytic drugs, you can use this one. Imbalanced nutrition less than body requirement, like this one who are malnourished. Readiness for enhanced health management. This is a wellness diagnosis where you are in health promotion. Readiness for enhanced nutrition. You want to provide a nutrition so that the life of the patient can be much better. So when you are in wellness diagnosis, you can use these ones. Keep watching. We are giving you a very good nursing diagnosis to use, like this neonatal hyperbilirubinemia. So when you say the nursing diagnosis is actual nursing diagnosis, it says what? It shows what? It shows the existing problem, like hypothermia. It shows that there is a fever. Hypothermia related to impaired thermoregulation. That impaired thermoregulation, it is secondary to sepsis. Like this sepsis is a medical diagnosis. You will not use it directly as related to, you will just say secondary to. When there is a proven medical diagnosis, you use it as secondary to. So it is a hypothermia related to impaired thermoregulation. What was like the causes of this hypothermia? Here on related to, you show the cause. What is causing this problem to happen? It is impaired thermoregulation. So this impaired thermoregulation, it is due to what? It is due to sepsis. Maybe there is a blood culture done. Maybe there is another investigation done like CRP and full blood count, and shows that there is ongoing sepsis. As medical diagnosis, it will be an indicator of this raising of temperature. Then you show as evidenced by like they are a proof, something that is showing that there is a hypothermia. It's an evidence, a measurable one, a temperature of 39.5. So you will address it accordingly, but this is an actual problem the patient is having. So it in the next type, it's risk nursing diagnosis. This is a potential one. It indicates that the specific risk factor are present. Like for example, risk for pressure ulcers related to prolonged bed stay. You see the patient is sleeping in one place and staying there. It's that patient at risk of developing pressure ulcers. Your intervention, it's about the health education you can provide. It's about changing the bed positions. So before doing that, when you are preparing the nursing care plan, this risk for pressure ulcers can be a good nursing care plan to show. There is a wellness nursing diagnosis. Here, it's a statement, a client statement of desire to attain higher level of wellness in some area of function. Like you see the patient is now improving, but you want to do something like of health promotion. You can decide to use this nursing diagnosis, which is a wellness, readiness for enhanced nutrition. Like someone is okay, but the nutritional status is not that much good, and you want to provide a health education related to it, or you want to do something related to nutrition, so you can use this one, readiness for enhanced nutrition. So here is an example of a nursing care plan. This is an example of a nursing care plan of TO. We use the initials for confidentiality of our patient, and then from the history taking, the patient was verbalizing about the fever as subjective data. From all the information you've gathered, there is a fever, and it should not be limited to one subjective data. There may be many, so you will list them here on the subjective data part. There is also objective data part. According to the physical examination you found and the measurement you've took, the investigation you've done, you find that temperature is 39.5. This is an objective. It's something you've done, not the verbalized, but you've done as a clinician. It will be here on objective data. And then you will be showing a nursing diagnosis. Of course, this is a very good nursing diagnosis, like hypothermia related to impaired thermoregulation secondary to sepsis as evidenced by body temperature of 39.5. This is our nursing diagnosis of the actual problem. This is an actual one. Remember that we say that there is actual nursing diagnosis, there is a potential nursing diagnosis, that one which included the risk. And I remind you that when you see that it's a risk nursing diagnosis, it contains only two parts. Only two parts means what? Like risk for that thing you are saying, and that problem a patient is at risk for, what is like an evidence for it, what is relating to it. The risk for pressure ulcer related to prolonged bed stay. It has two parts when it is a risk. But when it is an actual nursing diagnosis, it will be now three parts nursing diagnosis. So the first one will be a problem that is being is a real problem the patient is having, this first part will be for that problem, and then for the second part, I'm saying on the actual nursing diagnosis, the second part will be what is the cause related to that problem, what is the cause, and then after showing the cause, we will show the evidence. What is really the evidence that there is a hypothermia? Evidence is that I measured the temperature and I found that it is above, it is here 39.5. So this is a nursing diagnosis part, and then you will show the planning part. The planning part, you will say it in the way that it is client-centered. You will not say that to reduce the temperature. You will say client will experience body temperature relieved from 39 to normal range, which is 36.5 to 37.5 after 30 minutes of nursing intervention. So this objective of ours, you see that it is smart, it is specific. We are specific to the problem, which is to reduce the temperature. The problem we're having here, it's a fever, so we are specific to the problem. It is measurable because we say that we will took the temperature from 39 to normal ranges, so it is measurable objective. So this objective of ours, it is achievable. You can reduce the temperature and become to these ranges. So you should plan an objective which is achievable. You will not say that the wound will be healed in 30 minutes. It's impossible. So you will set an objective which you see that can be achievable according to the time you set, and then it will be realistic. It's real that we can achieve this in this time, and then you show the time bound, which is 30 minutes. If you do your intervention in 30 minutes, you will be addressing the problem totally. So an intervention, the intervention you've done, it is reduce bed covers and reduce clothing. Why do we reduce bed covers and clothing? Rationale which is behind here, when you reduce the bed covers, you reduce the heat, and then the temperature will be lowered. The next intervention is to administer antipyretic paracetamol 15 milligrams per kg as ordered by the physician. And here, this paracetamol, rationale behind it, it's a good antipyretic, so it will be easy to administer it and you reduce this temperature. So evaluation will be done after 30 minutes, and I said this evaluation part will indicate showing that the patient is now, you've now measured the temperature and you find that the planned goal has been achieved. To which rate? Totally achieved, partially, or not achieved. It is also possible, so that you can revise your nursing care plan and you plan accordingly. So that's a short summary of nursing diagnosis, and here there are some references of some information you can contact, and you dig deep and you find the information there. Thank you for following us here, and I hope it was helpful, and we'll be continue to updating ourselves. What we want here is just to be knowledgeable and to have a scientific rational things that we are doing. Thank you for watching.